first, Dr. Kohli, I do want to talk to you about the Omicron surge and how some people are already getting doctors to prescribe them a 4th dose of the vaccine. Now, they're already handing these out to older folks in Israel. I see that right here. But what's your take? And what is the rationale for people getting a 4th dose?
I mean, it sounds crazy, right? Within 1 year to get 4 doses. But the idea here is that we know that after our 3rd dose, after about 10 weeks, our antibodies start to go down. And there's so much infection around us that the scientists are asking the question whether we need to boost the immune system with a 4th dose. Now, what the studies are telling us, Sam, very small study with about 150 patients, if you give a 4th dose, you augment the number of antibodies that that person has. But in my mind, that doesn't answer the question of have you improved their clinical protection? Have you actually decreased the chances of them getting an infection or staying out of the hospital? So I think we need more studies before we give it to everyone.
You know, Dr. Kohli, I have to tell you, obviously, I've been out for quite some time. We had a COVID breakthrough case. And one thing that I noticed was the difference between the reactions with, for instance, I was Moderna, my husband was Pfizer, and we had very different reactions. Are people reporting differences in reactions based on which vaccine they took?
You know, it's funny you asked me that, Erica, because we've been talking about the gangs, the vaccine gangs. And anecdotally, it does turn out that the gangs have different behavior. And that essentially is because they have different degrees of protection. Because remember, the doses, if you got all Pfizer's, were 30, 30, 30. If you got Moderna's, it was 100, 150. So you actually got a much higher dose of the vaccine. And that's what some scientists think may have translated into potentially a little bit more potent immune response lasting longer. And it's your immune response that determines what symptoms you're going to have. So I'm curious, who had more symptoms, you or Anthony?
Anthony had more symptoms, and I was completely asymptomatic, and he experienced some symptoms, very mild, but I experienced nothing. And we've gotten all of our vaccines within a week apart, so we're pretty on par.
Interesting.
And I would also add that it depends on the viral dose. So Anthony probably got exposed to more virus than you did because he's the index case. He's the one who got it first. So that also determines how symptomatic we feel.
Well, Doc, I have to ask you, because I'm starting to hear people trying to treat this like the chicken pox, where they're like, let me just catch it on purpose and, just get it over with, get some immunity, I guess. There's even a doctor saying that this is a good idea. This doctor's in Philly, so this is not our Dr. Kohli.
Jackson, is it?
It's not me or Dr. Kohli, some random Philly doctor. But what would you say to that doctor and everybody that says, let's treat it like the chicken pox, let's have everybody get it and just get it over with?
I would say that's a pseudo doctor, even more so than you are, Dr. Jackson.
Thank you. I'll
because that
take
is
it.
not sound medical advice. That is just not sound medical advice, guys. Here are the reasons. Number one, you don't know what this is going to do in the long term. You could develop an autoimmune illness. You could develop long COVID, which we're seeing with Omicron. Number two, even if you're vaccinated and boosted, which, many people are, you could still end up in the hospital with Omicron. And we're seeing the number of cases of Omicron in the hospital really go up in vaccinated, boosted people. And the third, and probably the most compelling in my mind, you're not getting it over with. You could get it again. We all know people who've had COVID over and over again. It's a cold virus. Your immunity goes away. So if you get it now, there's no guarantee you're not going to get it again in a few months.
Good advice. Thank you for saying that, Dr. Kohli. Okay, let's get to your opinion in the news about Bob Saget's cause of death. Authorities did an autopsy, and the medical examiner in Florida said there was no evidence of drug use or foul play. Investigators are still looking into the official cause of death and say it could take up to 12 weeks. Now, police are saying that the way his body was found, and again, I want to speak about this respectfully because I know that this is an individual. This isn't just like a celebrity, right? This is a family member, a father. So the way that his body was found could point to a sudden heart attack. He was reportedly found laying face up with his left hand over his heart and his right hand at his side. So Dr. Kohli, I know you can't speculate, and we appreciate that. But more broadly, what could it possibly be? Because people are worried, right? A lot of people, especially his age group, are saying, listen, if I go to bed feeling fine, is there a chance that I could wake up the next morning not alive?
Yeah, and I want to say that I actually saw Bob Saget live when I lived in San Francisco, and I really did think of him as a family member because I grew up watching Full House. And I think his death, Sam, has taught us so much about how precious life is, because there's so many reasons that we could suddenly lose our life one day, or one of our family members could. And medically, statistically speaking, the most common reason, in fact, the #1 killer of men and women, is heart disease. So he either had a fatal heart attack, or he had something called a arrhythmia, which is an electrical abnormality in the heart that can cause the heart to stop suddenly. But we know that, if he had a family member with an aneurysm history, which he did, he could have had an aneurysm in his brain that could have ruptured, caused bleeding in his brain, and that's a death, within minutes potentially. There's also another blood vessel called the aorta, which carries blood out of our heart to our body, and that blood vessel can either tear or it can rupture, and that's called an aortic dissection or an aortic aneurysm, and that can cause death. And then there's certain types of stroke. So, he's taught us so much in life, but also with his death, I think.
Right. Yeah. My heart just goes out to his entire family and so many friends. I mean, we saw Jimmy Kimmel tear up. Everybody loved him. Dr. Kohli, he was on a podcast just last week. He was joking about having COVID and maybe even having both the Omicron and Delta at the same time. I want you to take a look at this first.
It is not good. It does not feel good. I had it. And,
that's not good.
I don't know if I had Delta or I might have had a combo. Maybe at one point they were working together. I don't know. I think at one point Omicron was opening for Delta, but then Omicron got so big, Delta's opening now.
Yeah, they switched you're right. They switched the lineup.
Always making us laugh. Okay, so Dr. Kohli, can you catch Omicron and Delta at the same time? And is there any way that this, without speculating, but could this cause heart issues later on?
So I know Bob Saget sounds like he was joking. He probably was. But yes, it is possible to actually catch Omicron and Delta at the same time. Highly unlikely. But think about it like getting influenza A and influenza B, two different sort of strains of the same virus. You can get them at the same time if you're exposed to them. They have the same risk factors, as you can imagine, travel in the same way. But I would highly doubt that his infection in December had anything to do with his current situation. Now, we do know that there are receptors for these viruses on the heart. So it's impossible to know for sure, but some small proportion of people that get COVID will have persistent inflammation of their heart afterwards, and that can lead to arrhythmias like heart stopping, that can lead to blood clots and heart attacks and such. So that's another reason not to go out there and just catch it, because it can lead to long-term problems. But in this case, it would be hard to make that connection.
Thank you, Dr. Kohli, as always. We appreciate you.